Disclaimer: this is a student presentation using a hypothetical scenario for educational purposes. The presenter is a student at UAMS, not a representative of the agencies named in the following slides. The information contained herein does not necessarily reflect the views of any said agency. Hello everyone, I'm Ashley Hansen, and I have been asked to speak with you about the 2014 Elk River chemical spill in West Virginia. We'll be looking at how residents of West Virginia were affected and whether or not we should be concerned about a similar event happening here in Arkansas. On the morning of January 9th, 2014, as children were being dropped off at school and adults were heading to work, reports of a sweet, licorice-like smell began to pour into the West Virginia Department of Environmental Protection's Kanawha City headquarters. 2 DEP employees, Air Quality Inspector Mike Kolb and Air Quality Engineer Dan Barl, also noticed this smell. The pair suspected something had happened at a nearby facility owned by Freedom Industries, a chemical distribution company, and were dispatched to investigate. The company's CEO, Gary Southern, originally stated a hole in one of the facility's holding tanks was discovered by 2 employees at 10:30 in the morning, and containment measures were immediately taken. However, when Kolb and Barlow arrived at the facility just after 11 a.m., they discovered a 4-foot wide stream flowing across the floor of a concrete containment dike into the ground and a 400 square foot pool of the chemical 4-methylcyclohexamethanol, or MCHM. It was near this pool that inspectors discovered the containment efforts made by Freedom Industry employees: 1 cinder block and a 50-pound bag of absorbent powder. The effort was described by Kolb as a Band-Aid approach, and apparent that it was not an event that had just happened. By Friday, January 10th, schools had been closed, supermarket shelves were bare, and a state of emergency had been declared by both West Virginia and the federal government. Residents of the affected counties, approximately 300,000 individuals, were ordered to not use the water coming from their taps for drinking, cooking, or bathing. Restaurants were closed, and hospitals had canceled all non-emergent surgeries. FEMA and the National Guard had been dispatched to distribute bottled water. To give you an overview of our discussion today, I will be answering the following questions. What is MCHM? How were residents affected by the Elk River spill? What are the short-term and long-term effects of MCHM exposure? What happened following the spill in regards to regulation? And should we be concerned about a similar event happening in Arkansas? So what exactly is 4-methylcyclohexane methanol, or MCHM. Even though it was a chemical mixture that leaked from the corroded holding tank at Freedom Industries, MCHM became the focus of multiple studies following the Elk River spill because it was the primary chemical in tank 396 at the time of the corrosion. MCHM is an organic alcohol used to clean coal. According to the patent held by Nalco Chemical Company, MCHM is used in a patented frothing process that separates impurities from coal, making it safer to burn. So let's talk about the effects of the spill on the residents of the 9 affected counties. Again, it was approximately 300,000 individuals. Eastman Chemical, the manufacturer of the crude MCHM, had basic toxicology assays done on the chemical in 1977 and 1998. But prior to the Elk River spill, little was known about the effects of MCHM exposure. Immediately following the spill, local, state, and federal health officials examined what little toxicology information there was available and recommended screening for MCHM at 1 part per million, as it was not likely to have any adverse effects at that concentration. But because the effects were still such a mystery, the recommendation was made less than 24 hours after discovery of the spill for residents to stop using their water in their homes or offices for drinking, cooking, or bathing. In the 2 days following the spill, the MCHM levels in tested drinking water ranged from 0.18 to 3.12 parts per million, with an average of 0.88. By the 3rd day, all tests showed less than the recommended screening level, and state officials began lifting the do not use order by January 13th. Still, between January 9th and January 24th, 2014, over 2,000 people called poison control, and there were 369 emergency department visits related to exposure to contaminated water. Reported symptoms included mild skin irritation, abdominal pain, nausea, vomiting, and headache. Of the 369 patients who sought medical care, only 13 were admitted to the hospital for overnight observation as a precaution related to pre-existing conditions such as COPD or diabetes. The majority of residents who experienced adverse effects from MCHM exposure were able to treat their symptoms at home under the direction of local health officials. The real concern was not the short-term effects, but what MCHM exposure could do in the long term. Studies done on MCHM exposure during embryonic development demonstrated a link between MCHM exposure and low survivability, hatching, morphology, and locomotion in zebrafish, and low birth weight in mice and rats. In July of 2014, the U.S. Department of Health and Human Services National Toxicology Program was asked by the Centers for Disease Control and Prevention and the Agency for Toxic Substances and Disease Registry to conduct a series of toxicology studies on MCHM and other chemicals known to have spilled into the Elk River. The NTP studies ultimately concluded that at the concentrations measured in the days and months following the spill, there was no risk of long-term effects and no evidence of low birth weight or prenatal development issues in newborns following the spill. Now let's talk about what happened as a result of the Elk River spill. The 2014 spill demonstrated a drastic lack of oversight and need for better regulation at both the state and federal level. Some of the biggest issues specific to the 2014 spill being the leak not being reported by Freedom Industries, the lack of oversight. There had been no inspection of Freedom Industries since 1991, and the lack of plans for notification by Freedom Industries to the local water company or the water company to shut down its intake valves. The specific area of West Virginia affected by the 2014 spill sits in a 25-mile stretch along the Kanawha River known as Chemical Valley. It is called Chemical Valley because of the chemical manufacturing industry, and more than one incident in Chemical Valley has sparked national reform in chemical safety and security. For instance, a 1985 leak led to the National Emergency Planning and Community Right to Know laws and the implementation of the U.S. Chemical Safety Board. In response to the 2014 spill, West Virginia legislature unanimously passed a bill increasing regulation of above-ground storage tanks near water sources to protect the drinking water supply. The legislation also required public water systems across the state to rewrite and/or improve source water protection plans to include a full inventory of potential contaminants. A Senate bill was also penned in the aftermath that would require the EPA inspections at all above-ground storage facilities, improve facility designs, better leak detection, training for all staff, spill control policies, and emergency plans. I suspect the big question now is, should we be concerned about a similar event happening in Arkansas? If it's specific to MCHM, probably not. But many of you may remember the 2013 Mayflower oil spill when ExxonMobil's Pegasus pipeline ruptured, necessitating the evacuation of 22 homes. ExxonMobil settled its charges of violating state environmental laws and the Clean Air Act in 2015. In 2018, the EPA announced a settlement with Georgia Pacific for violations of the Clean Air Act at the company's Crossett, Arkansas facility, where residents claim toxins from the plant have been making them sick since the early 1990s, even though there's no evidence of increased rates of cancer in Ashley County. Last year, Delek Logistics, a Tennessee oil company with a history of environmental noncompliance in Arkansas, was fined $2.3 million for a crude oil spill in a sparsely populated part of Columbia County in 2013. A portion of that fine will be paid to the state, the money going toward the state's Hazardous Substance Remedial Action Trust Fund, which largely handles emergency response to hazardous substances. The state and federal regulations, coupled with regular inspections, help prevent events such as the Elk River spill from happening. Though noncompliance, such as in the case of Delek Logistics, or lax regulations, like we're seeing in West Virginia, will always pose a potential threat. The state of Arkansas requires a permit to treat, dispose of, or store hazardous waste under the Arkansas Pollution Control and Ecology Commission. Additionally, the Arkansas Remedial Action Trust Fund Act that I briefly mentioned before not only provides the state with the necessary funds, but also the authority to investigate, control, prevent, abate, treat, or contain the release of hazardous substances to protect public health and the environment. Perhaps the best answer I can give you is there is always a potential for a chemical spill where there is industry, but that doesn't mean we should panic. I have included my references on 2 slides, and I am happy to answer any questions you may have. Thank you for listening, and I look forward to our continued discussions.